So I just want to start out by saying to colleagues, we've got a lot of people who've joined us in this session, so we won't be able to go around and do some introductions. However, you're welcome to introduce yourself in the chat and just say who you are and where you're from. I'd like to thank you for joining us this morning. We appreciate how busy it is for everyone who is working. I know certainly most of us had thought around this time things would have slowed down with COVID-19 and would be back to our pre-COVID days. However, that's not what has happened right now. So what we'd like to do is to just start out by saying to all the colleagues, thank you for all your hard work. Thank you for your support. We appreciate how really busy it is and cannot really emphasize how we appreciate you actually joining this session this morning. I'll start out by just giving a few housekeeping rules. So if you're not speaking, please can you put yourself on mute so that we don't have any sort of echoes in the background. This session is going to be recorded. So if you do not want to come out on the main recording, you can turn your camera off. The session that we're going to have when we step into our breakout rooms will not be recorded. So we won't have any recordings within the breakout rooms. That's a safe psychological space where people will be able to ask personal questions or also make comments on the various issues that will have been picked out in the session today. My name is Linda Chibuza. I'm the Deputy Director of Nursing in Nottinghamshire Healthcare Foundation Trust. I also wear hats and caps to various other meeting groups that I attend. I'm the Deputy Chair of our BME Staff Network in Notts Healthcare. I also sit as a member on the Chief Nursing Officer, Chief Midwifery Officer Strategic Advisory Group for BME, the SAG. And I'm very much pleased to let you know that we do have a packed agenda with various speakers. So that means throughout, I will be coming in to introduce the next sessions and our speakers will introduce themselves. So I won't labor going through introductions of our speakers. Just to let colleagues know and to reassure you, this session has been organized for BME staff. However, there are a lot of sessions that are going on throughout our ICS area and within our organizations in order to provide information to staff and to support staff around vaccinations. So this isn't targeted on individuals because they are not vaccinated or because they are vaccinated, but it's actually a supportive session to provide information and for us to have some discussions around what information we know and also just to hear from other colleagues who have had their experiences. They'll be able to share those. I just want to also mention that we do want to be able to have a safe space for you to be able to discuss any issues that you might want to raise specifically around vaccinations. What we won't be able to do, colleagues, is to answer HR queries because that's not what the session has been geared upon. It's actually been geared upon addressing the issues of vaccinations. We also want colleagues to know that attending one workshop is not the end of our vaccination awareness and information sharing. By all means, please attend other workshops and make reference to information that you get from this workshop or various other workshops, because what we're keen to do is to ensure that we all have as much information as possible and we're able to share that information. I'd also want to just mention to colleagues that as we have a really packed agenda, we will not have the sort of formal question and answer sessions following each speaker. So where time permits, the speaker may then say, I'm able to take one or two questions, but where time does not permit, they may not be able to answer your questions immediately, but throughout the session, the chat will be open, so you can put in your questions, your comments, and you can also make a specific request to be followed up after the session. So I am around this afternoon. So if anyone wants me to then contact them after the session, if you drop it into the chat, I'll be able to contact you today just up until 4 p.m. I know my other colleagues will also be able to answer queries, so we can then signpost to the relevant person to be able to answer your query. If you are going to leave the session before it ends, just make that known in the chat, and then you can drop off the session. You don't need to raise your hand and let us know. We know that we're working within a world of virtual working. So if we do have any IT issues, i.e. if one of our presenters gets cut out of the meeting, I will come in, I will talk to you whilst the person tries to rejoin the session. If you get cut off, don't worry about it. Just try and rejoin the session. And if you're not able to rejoin the session, if you can just send a message to a colleague, we'll know that you're having IT issues and we'll try to support. During the time that we go into breakout sessions, you will be able to choose which session you want to go into, and you'll do that by clicking onto a specific link to join one of the breakout sessions. You may not know which breakout room you want to go into, so you could go into one breakout room and then a few minutes later decide, actually, I want to go into another one. Just let them know in the chat that you're leaving to join another session. Otherwise, people get worried and they're not sure why they're losing people within that session. Again, as people go into the various sessions, you'll be able to ask questions within those sessions. And what we will do when we come back at the end of the breakout sessions, because we won't be able to go into all the breakout rooms, we will then have the session facilitators just summarize and give us the points, the key points that have been discussed and raised. There will be opportunity for you to give us feedback. So again, that's something else that you'll be able to utilize, and I'll ask Catherine Concha to share with us how people will be able to give their feedback at the end of the session. So without further ado, I am going to ask our first speakers to come in and talk to us, Tracy Olande, Shirley Field, and Elizabeth Calderbank. Thank you, colleagues.
Good morning, everybody. So my name is Tracy Orlandi, and I've got 5 minutes just to talk to you about some of the most recent facts and figures before handing over to my colleague and then coming back to talk about staff support. My colleague Shirley Fields isn't going to be presenting the slides with me, but is going to be in the outbreak areas later if anyone has any questions or queries regarding some of the data that we're sharing with you today. In particular, I think we've had quite a few inquiries around will I be medically exempt from the COVID-19 vaccine, recognising that there are some health conditions. There are some health conditions that I think I've got a bit of background. If we could be on mute. There we go. No, not on mute yet. I was muted then. Am I back? Lovely. Sorry, we had a bit of background noise there. So the Green Book specifies medical exemptions from people for the COVID-19 vaccine. And we do know that several colleagues have said, there are more medical conditions perhaps linked to BAME groups statistically, so will we be exempt? So we won't cover that in the slides, but we're happy to take questions within the breakout areas. So without further ado, I'm just going to share a few slides. So I've already introduced myself. I work for Notts Healthcare, but I also have a system role within wellbeing, and as such have had various interactions with different organisations and different steering groups within them that have informed some of the information that I'm going to share with you today. So I think we'll all be aware, either through our trust or organisational communication channels and the media and recent publications, around the national mandate for vaccination as a condition of deployment. As Linda mentioned earlier, we're not going to be covering the HR issues or the specifics around this mandate within this session today. And the main reason for that is that we're still waiting for the second, more detailed guidance that will be published on Friday. So I think what's difficult for people is that we're aware that the vaccine had become compulsory for social care back in November. We knew that there was a consultation to implement the same guidance for people working in health and social care, which went to Parliament on the 9th of November and subsequently was approved, with the first set of guidance coming through, and as I mentioned earlier, the second guidance being published on Friday. Now, what you may not be aware of, and I've just spotted a typo, I do apologise, is a webinar that's been called on Friday the 14th, quite late in the day, because we're expecting the guidance in the day. So this will be a very hot off the press workshop specifically for BME Strategic Advisory Group. And I'm going to drop the link for that meeting into the chat. So that will cover some of the detail around what this means for people's employment. So that's a bit of signposting to a very detailed event that's been held nationally that all staff are invited to attend this Friday. I've also been asked to cover a query that's been coming up quite frequently around how will my organisation know whether I've been vaccinated or not, and I haven't consented for that information to be shared, so how have they got that information? So I thought I'd just cover that briefly, but again, I'm happy to take more detailed questions. Oh, I've come off slideshow. I'm happy to take more questions when we go into the Café outbreak. Am I back on slides? Yeah. So the data on unvaccinated staff comes from the National Immunisation Management System, and the COPI laws that were put in place throughout COVID around data protection, information governance and other COVID-related activities allow the NIMS data to be shared with organisations. Now, the difficulty with NIMS is it matches people based on their surname and their postcode. So if you've got married, changed your name or moved, NIMS may not be able to identify you as vaccinated, which is why many organisations have started the preliminary work of asking people their vaccination status where NIMS is showing that they're not vaccinated. And once providing evidence on vaccination, that will be recorded within the trust for onward purposes in terms of the process moving forward. So it's unheard of for people to share information in this way. You wouldn't normally share any GP or vaccination status with your employer for any other vaccine, but for the purposes of COVID, that has been shared and approved from an information governance perspective. In terms of where we are now with the pandemic, I think in wave one, we saw a much higher mortality rate for certain ethnic groups, and there's a lot of data in this slide, but I'm just going to pull out the main points really. And we did hope that as the emerging evidence transpired and we knew more about the pandemic and what we were dealing with, that we would see a shift in that mortality rate so that we could take positive measures to ensure that although some groups would have poor health outcomes, that they wouldn't unfortunately die from coronavirus. I think what's interesting is the last bullet point on this, which is after adjusting all of the other measures, occupational living arrangements, the second wave has still shown that there is a higher risk to BME groups and higher mortality rates in wave two as well as wave one, which I think, although people will make very personal decisions whether to have the vaccine or not, it still presents a very real and high risk to certain groups. What we also know is that the vaccine uptake in BAME communities as a whole has been lower than other comparisons to other ethnic groups. And the Royal Society of Public Health undertook quite a lot of research earlier in the year around why people may or may not have the vaccine and the reasons for not having the vaccine. What I wanted to present today, but I've been asked not to, but I will follow up outside of this meeting in terms of when we share the slide decks, is the vaccine uptake within health and social care within Nottingham and Nottinghamshire, the ICS. The reason I've been asked not to share it today is we're just doing a refresh of that data. So I would like to present to you what the current uptake is within our workforces as an entirety, which is a 60,000 strong workforce, and in comparison to what that looks like. So apologies for not having those statistics with you today. That's taken up my full 5 minutes for the updates around what's happening nationally in the facts and figures. I'm just going to hand over to my colleague for their 5 minutes, and then I'll come back to speak to you about what's available in terms of support if this is making you feel particularly concerned and you want some individual advice. Thank you. Is Richard on the call to hand over to?
Oh, hello, good morning, everyone. So I'm going to speak on behalf of Richard Holder. Unfortunately, he cannot be here today. And I'm going to share some of the, so what we're doing at the Nottingham University Hospital. Let me just very quickly share my screen with you. Can everybody see this?
Yeah.
So my name is Elizabeth. I am the Bain Strategy Program Manager for Nottingham University Hospital. And so before I talk about the experience that our BME workforce have at NUH, I just want to give you a brief introduction of the vaccination uptake that we have currently at NUH. This is the data for the last week. As you can see here from this graph, 82.5% of the BME workforce have taken the first vaccination, 78.4% have taken the second vaccination, and 52.7% have taken the second vaccination plus the booster. I think despite the trend is going upwards within the organization, which is a positive thing, there is a lot of work to do in regards to what we need to do to engage with our BME workforce within NUH. So in terms of the main reason for hesitancy, it's about the vaccine side effects, including the long-term effects on health, the phobia to the needle, the lack of trust in vaccines, particularly among Black respondents, missing information. So people are currently bombarded with lots of misinformation coming from social media, and this has generated a lot of anxiety within the BME workforce. Also, historical mistrust of the government and the public health bodies that runs deep within the ethnic minority groups, and some of the staff roots in long held belief that would not be easily swayed by statistics. But the good news about this is that some of the staff can be encouraged, and with with active listening and the right engagement and the right support, staff can still change their mind and take the vaccine. And one example of this is, for example, the team I line manage. We are all Bain colleagues from different ethnic backgrounds, and there have been lots of concerns about what the content of the vaccine have, particularly within our Muslim colleagues, the content of the vaccines within the period of Ramadan, is that we're going to break their religious belief, etc., etc. So what we are doing is encouraging staff to go to relevant websites with scientific information, to listen to the professionals, to engage with people that already have the vaccine, so they can hear what the experience has been. We have been encouraged people to go to the vaccination hub and get more informed. So basically to know all of the misinformation that have been in social media. In terms of boosting the number of BME colleagues that can have the vaccine, the first things we need to do is about building trust. So tackling the reason for hesitancy requires engagement, understanding, and trust. And this is important because we need to take seriously what our BME colleagues are telling. So all of the doubts and concerns they are bringing to the conversation, is important that we listen, and that we will listen with respect, and that we communicate effectively and offer practical support to everybody, so they can to make sure, or to encourage them to change their mind. It's also important to keep staff informed about, for example, the percentage of BME colleagues that hasn't had the vaccine. And this is important because the more they know, the more informed staff are, the higher the chance to for them to change their mind. And also we can target, a specific groups in terms of, we know, for example, BME colleagues from Black ethnicity, particularly from Black African, Caribbean, Bangladesh, Pakistani communities are the more the higher hesitancy is what the higher hesitancy is at the moment. And also, Richard, the chair of the BME Staff Network, will organize drop-in sessions for staff to start compassionate conversations about the challenges that the COVID-19 brings to us as a collective and also within our individual communities. I only have 5 minutes to present today, and I prepared this presentation at the last minute because I wasn't supposed to be here today. So if you have any further questions in terms of the data that I present to you today, or any other project or work that we are doing to encourage, the vaccination uptake within our BME workforce, please, by all means, ask me all of those questions within the breakout room, and I will be ready to answer all of those questions. So I hope you found it helpful, this quick message, and we're doing lots of work at NUH, but I'm happy to respond all of your questions within the breakout room during that time. Thank you so much for your time and for listening.
Lovely,
so we hand over to the other person.
Lovely. I shall just share my slides. I appreciate we're over time, so I'll be quite succinct on this one. So just going into staff support, I think it's safe to say that this is a difficult time for many people. People are tired after 2 years of working within a pandemic, and obviously this national mandate is giving cause for concern for individuals and organisations and teams collectively. So many organisations will have their own support networks, and we're not here to replace that, but we do have an integrated care system, Nottinghamshire Staff Support Service, that colleagues may not be aware of. We offer free confidential advice and support, not only for people who may need rapid access to mental health assessment, but just colleagues who need a safe place, somewhere that they can share their thoughts, feelings, questions or concerns, and we can provide a signposting service as well as a therapeutic one to people who need it, to get the information that they need to help them at that time. We're a multi-professional team with clinical psychologists, mental health nurses. We're very diverse. We can have culturally sensitive conversations and are aware of some of the specific issues and challenges that organisations and individuals will face at this difficult time. So just to make you aware of the services that we offer, it's quite broad, but the support that I'm going to touch on detailing today is the one-to-one support. So just very briefly, it starts with a conversation. It's very person-centred. How can we help you today? What are your questions, queries or concerns? Who do we think in the team will be well placed to help you with your inquiry? Do you need more structured support in terms of an assessment and therapeutic support, or do you just need somebody to talk to with some advice and signposting to help you with the presenting issue? Make sure you're getting factual information, and then a bit of a follow-up to see whether that information helped you at that time and moving forward. It's completely confidential, separate from your organisation, and we endeavour to help where we can. The slides will be available, but I'm also going to drop these contacts into the chat because the slides may take some time to reach you. The email address and the portal are the preferred mediums for many of our colleagues to make contact with us. So specifically, please do feel free, don't hesitate to contact us if you're in this session and thinking, actually, I could really do with a little bit of confidential help and support. So with that in mind, I'm going to drop that into the chat and hand over to the next colleague for today's session. Thank you.
Thank you very much, Tracy. So what I just wanted to do is to just remind everyone that's here that the next session is over to our medical colleagues who are also specialists in these fields and areas. So we have Dr. Chitra coming in first, Professor Shem will be next, and then we have Dr. Dr. Vaishali, and then Dr. Ann will close off. So colleagues will introduce themselves as part of their presentations. Again, if you have any questions, comments, you can put these into the chat, or you can make a note of that specific speaker and then join the breakout room where that speaker will be. So over to you, colleagues.
Hi, I'm Chitra Acharya, Primary Care Network Development Manager in the CCG. I'm a computer scientist by background, and my PhD research was in human-computer interaction and patient safety, which is why I am now in the really exciting role that I am in engaging with our diverse communities and helping reduce inequalities and promoting inclusion. At a local level, I'm a patient leader at the CCG and a patient citizen leader at the ICS. I'm also a peer leader at the national level. I'm a carer. I care for my I care for my severely disabled son who has complex needs. My husband is clinically extremely vulnerable. Over the past couple of years, I've lost family and friends to COVID. Personally, I believe the COVID vaccines are safe and effective and can reduce the risk of getting and spreading the virus that causes COVID-19. I got the COVID vaccine, the first dose, second dose, and booster to protect my son, my husband, my family, and the community. I was really grateful when I was offered the COVID vaccine. Thanks to the NHS, I am now double jabbed and boosted. With the threat of Omicron variant, I feel safe because the vaccines will increase my chances of survival and will protect the older and more vulnerable people in the community. By explaining how important it was to get the COVID vaccines, I encouraged people from the BME community to be vaccinated. They are glad they had it and now they feel safe because the COVID vaccines provide strong protection against serious illness, hospitalization, and death. There is also some evidence that being vaccinated will make it less likely that they will pass the virus on to others, which means their decision to get the vaccine also protects those around them. I persist to debunk some of the myths around COVID-19 vaccines. I encourage everyone to have the vaccine unless they are exempt for medical reasons. Thank you.
Thank you very much, Chitra. Next is Professor Shem. If Professor has not joined the session, welcome.
Hey, morning, I'm here. I did send a couple of slides to the team. Do you have them, or shall I try and share my screen? Nobody's got them? I'll try.
Happy for you to share your screen, please.
Okay, I shall try and do that. I'm sorry about that. Let's see if I can get this to work. Let's choose that one. Right, are you seeing a screen that says vaccine effectiveness on the graph?
Yes. Yes.
Oh, perfect. Thank you. So just for information, I'm a chest physician and I am chairman of COVID-19 vaccination on the Joint Committee on Vaccination and Immunization, which is the independent body that advises the government on vaccine policy. I just want to show two slides, really. The first slide are these data that show vaccine effectiveness against Omicron. And what you're seeing are the dots, if you will, of vaccine effectiveness against symptomatic disease. So these are people who have some symptoms, go on to have a PCR test. And on the left-hand side, you will see two lines or dots of lines, one in black and one in gray. The one in black reflects Delta infections. And you'll see that on the very left-hand side at the bottom, it says dose 2, 2 to 4 weeks. So this is the protection against Delta symptomatic infection at the start of having had 2 doses of vaccine. And as you go along in time, so you see at 25 weeks, the protection against symptomatic infections from Delta decreases, and this is what's called waning. For Omicron, we start off slightly lower than Delta, and that's about 60%, and you'll see that also wanes with time. With the booster dose, which is the area that's shown in the sort of blue box, the booster dose boosts that protection up to very high levels. So for Delta, after a booster, the protection against symptomatic disease is now almost 100%, and it stays very high for the duration of follow-up that we have. For Omicron, it goes up high, but again, you see waning. And this is true for symptomatic infection, but it is not true for hospitalization, and that's the really important point. I don't have a slide for hospitalization because we don't have all the dots in this way, but for hospitalization, if you were to draw a graph, then it would be for Omicron right at the top here at 90% all the way through up to 12 weeks. This is the difference between protection against just symptoms versus protection against being really ill. And the protection against admission to intensive care or from sadly dying from Omicron is even higher. So it'll be above 90%. We expect it to be 95% and above, and lasting for easily 3 months. And that's why you see that we have a lot of infection in the UK at the moment, lots of cases, but not so many hospitalizations. It really works very well against severe disease. My next slide is about vaccine safety. And before I go through this slide, I just want to ask how you would feel if I made the statement to say that crossing the road is safe. And then think how you might feel if I gave you the statement, crossing the road is unsafe. I'm going to suggest to you that both of those statements are untrue. Crossing the road is not safe at some times. It is reasonably safe, but we cannot say absolutely it is safe. It is also untrue to say that crossing the road is unsafe. It is relatively safe and relatively unsafe. And the same kinds of statements have been made on social media and elsewhere about vaccines. People claim that vaccines are safe or vaccines are unsafe, and those two absolute statements are simply untrue. Vaccines are reasonably safe because, like any medicine, they have some side effects, and the question is whether those side effects are worse or better than the disease itself. One concern recently has been women who are pregnant and what the birth outcomes are like, because there's concern that it affects fertility or the child that's born afterwards. And this is just one slide of an example. And in the columns here in blue, orange, and gray, we have people who've had no vaccines, people who've had a vaccine, and it shows low birth weights of the children that are born. And there is absolutely no difference according to vaccination status. What this is telling us is that vaccination itself does not alter one's birth outcomes. And there's a whole range of birth outcomes, not just low birth weight, but mortality and so on, that have been examined by the UK Health Security Agency, showing there's no difference whether a woman is vaccinated or not, and their birth outcomes. And it's as an example where we don't need to worry about claims of safety concerns that are, I think, untrue. I'll just stop there. Thanks. Have I unshared now? I hope I have.
Thank you very
Yes,
much.
you have.
There's a few questions for you, Professor, in the chat. So if you're able to assist and provide responses to that, that will be really appreciated. And then I'll ask Dr. Prith to step in, please. Thank you.
Thank you very much. So my name is Prith. I'm one of the infectious diseases consultants in NUH. And I don't have any slides to share, so you just have to look at me, I'm afraid. I want to give a different perspective. I look after a number of immunocompromised patients of BAME backgrounds. I've done a lot of conversations about vaccination and vaccine hesitancy in my clinic setting. Within the hospital, I've also come across staff who've asked about vaccines. And the perspective I want to talk about is really the perspective of one-to-one conversations. And I think the points that I thought I'd make, actually, some of them have been made already. And I think that when I have a one-to-one conversation with someone, well, this isn't a new situation. Over the years, as a health practitioner, we're always talking to people about new drugs, new medications, new treatments. And sometimes when it's difficult, we have to think about people's hearts and people's minds. In terms of the people's minds, they perhaps want to know the good versus the bad of this new thing. And when we think about good versus bad, that's two of the ethical principles that we use in our discussions. The good is beneficence, the bad is maleficence. And we now have a lot of data around COVID vaccination in terms of the good and the bad. But we've moved on from that in discussions now to this legal mandate situation. And you'll know that some of the other ethical principles are the legal dimension. And the other principle is the one of autonomy, where individuals have a choice in the matter. So when we're talking with people these days, usually when we have conversations, rather than telling people what to do, our natural approach is to be alongside them, trying to see things as they are seeing things and trying to move forward step by step together. What I find with this legal situation, it's changed the dynamic of that. And I can understand where we've come to this point. I can see both sides of the argument, but it's changed the relationship in that discussion. When there isn't a legal mandate, often the autonomy of the individual may prevail, but the situation is different. And if we go back to thinking about hearts and minds, there's more here to do with changing hearts, not changing minds. And I think in terms of the emotional aspects of the discussion, what I find is that central to dealing with whether people's heart is to move forward and have the vaccine or not, is that you have to have a relationship that's built on trust. And if there isn't that trust, that conversation will not go very far. And if we look deeper behind what matters with trust, I think a key point is being honest. And I don't know everything. I'm not sure I'm going to be able to handle the breakout room because I won't know all the answers. But you can be honest about that. And I think people appreciate that. I think the other aspect of having trust is to listen and not make any prior presumptions about what the other person is thinking and what you think their fears might be. And one example is that on Monday I was chatting to a member of staff and I was thinking, oh, I need to brush up on all the latest facts and figures about COVID vaccine, this, that and the other. But actually, as the conversation pursued, the issue wasn't COVID per se, it wasn't COVID vaccination per se, it was just a needle phobia. In fact, that individual doesn't go for a flu vaccine either because of the needle phobia. So it's fears around that that ended up being the issue and the point of discussion. That person's booked in to have the COVID vaccine now, but unless you listen, you don't know what the points are that need to be explored. Thank you very much.
Thank you, Dr. Prith. And I'll now invite our next speaker, Dr. Vishali.
Hi, I'm Dr. Kogji, and I work as a consultant forensic psychiatrist in Nottingham. And I'm not a respiratory expert or an infectious disease expert as such, but I'm a clinician at heart. So I personally have taken all the 3 jabs, including the initial jabs as well as the booster. And also my family members have taken the jabs, those who were eligible for it. I work on a ward with 20 patients, and it's a secure ward. And I'm proud to say that 19, other than 1 patient, all the patients took up the jabs. And the interesting bit was that they found the one-to-one conversations with clinicians very helpful. And it helped to resolve some of their queries, some of their fears, their doubts. And I do recommend that, if people have certain doubts, it's good to see one of your line managers or some clinician you have a good rapport with and talk to them about your fears and doubts, because one-to-one is far more effective. But this is a good forum to get some information. The patients received the Oxford AstraZeneca vaccine. And the interesting bit now is that in more recent times, it's the non-vaccinated staff who have been off sick, but the patients themselves have actually, none of them have actually as yet tested positive. Those, on other words, who have tested positive, they've not come down with a serious infection. So on that, I just wanted to share a slide which gives some information. Is this visible, the slide?
Yes, it is. Yes, it
Yeah.
is.
So this is some information from the Office of National Statistics. And if we notice, a lot of our staff will be falling between from here to here, which is the 30 to 65 age group. And if you notice the critical care, this is the critical care admission by vaccination status. So this says, this is just a straightforward admission to an ICU. Yeah. And if you notice the difference between the unvaccinated and the vaccinated ones, whether it is double boosted, double vaccinated or boosted, that is a massive difference, especially as the age group increases. As a lot of us will already be aware that, we do have better immunity when we are younger. So clearly having that immunity is a good thing, but the vaccine does help back up that immunity as such. So I'm going to stop sharing that slide for now. From that point, I felt that, it was important to protect. The reason I took my vaccine was it was important to protect my patients. It was important to protect my family. For my older one who was eligible for her vaccine, some of her friends who weren't vaccinated ended up missing lessons at uni, whereas she has managed to attend all her lessons. She's not missed out on her academic opportunities. And I think there are benefits in protecting not just yourself, but in others. I will say, as Professor Lim has already explained, that all vaccines, unfortunately, will have side effects. So it's not 100%, nobody can guarantee 100% safety. But as I say, if you have any questions which you think need a more one-to-one discussion, feel free to talk to us, feel free to talk to people around you who you have a good rapport with. and try and discuss these matters. There is a lot of information around, and I'm sure you'll be able to access that and challenge people, ask the questions. Yeah. All right. Thank you very much. I think that's all I will say. But as we know, we all are capacitous people. We all have our own abilities to understand things, and it is up to each individual to take that decision, whether they consider it either way. Yeah. Thank you.
Thank you very much, Dr. Kogji. I'll now call off on Dr. Anu, please.
Good afternoon, everybody. So to give you a background about myself, I was born in India, and I then grew up in India for a bit and in various different countries after that. I've been getting vaccines from a very young age, starting from the TB vaccine given around your birth time in India to later on get the diphtheria vaccine, polio, mumps, more recently the hepatitis B vaccine, the flu vaccination, and now the COVID vaccine. During, I haven't had it, but I've heard of smallpox being eradicated because of vaccines. My parents, I've seen them having the vaccine scar. And during my training to become a doctor, I've witnessed the drive in India for the polio vaccine, and then the polio becoming eradicated in India, or receiving the polio-free certification from WHO in 2014. So I've seen all that happening. I also have an autoimmune condition, and due to that, I often get, when I get any kind of infections, I do get quite weird and wonderful symptoms from that. Not only that, even after the infection is over, I get quite a lot of different prolonged symptoms as a result of my autoimmune condition. When COVID started, to be honest, I thought about myself as quite selfishly, thinking, oh my goodness, if I get this, what am I going to experience now? This was during the very initial phases. Then I started seeing people getting quite ill around me, getting a lot of complications. And I would say in the matter of about 5 months, I lost about 81 of my relatives, friends, extended family members. Lockdown was there. I haven't been able to see a lot of my family members, not sure where I'll be seeing them again. I felt quite trapped, quite helpless, quite hopeless about the whole situation. And I found that a lot of my patients around me and members of staff working with me echoed the similar kind of similar kind of mental state as well as I was experiencing. And then the vaccine came, and that felt like a ray of hope for me, because as I said, I've been exposed to vaccines for a very long time, and I saw this as my exit getaway, really, seeing how vaccines have worked for other diseases in the world. And hence, I got the vaccine. So, ladies and gentlemen, I am Anupriya. I'm a consultant psychiatrist working at Bassetlaw Mental Health Services. I've had my 2 vaccines and the booster. I hope that through this session today, I'm able to provide you with some relevant information. Maybe I'm not able to provide you all of it today, but hopefully in the future as well. Share my experiences and hopefully be able to aid you with information that helps you to make an informed decision around the vaccine. What I would always suggest that if whenever you're making a decision, think about your personal circumstances, your family, and what's relevant to you. Yes, I completely agree that vaccines can cause problems with certain groups of people. It may not be for everybody, but what's important that always think about yourself, think around your circumstances, and make your decisions based on that. That's all from me today. Thank you very much.
Thank you very much, Anu. for sharing that really personal experience. And I'm sure we have a lot of colleagues who were also very much impacted, and it's always useful to share those experiences and hear from others. We're now getting to the section where we will go into the breakout rooms. Just to remind colleagues, we've got 4 breakout rooms. So the first breakout room has Professor Shem with Tracy Orlandi. The second breakout room, Dr. Prith and Elizabeth Calder Pank in that breakout room. The third breakout room, Vaishali Kogji, Dr. Vaishali Kogji, Dr. Chitra Acharya and myself. The fourth breakout room, Dr. Anupriya and Shirley Fields. And then what we've also set out to do is throughout this session, this cafe will remain open so that if people dip in and out or have a specific question, they can raise it within this main cafe room, which is the coffee room. You can raise those questions again. We'll ask you to then click on the link to the breakout room that you're going into. If you get stuck, my colleagues, Catherine and Miles, will be there to, Catherine and Giles will be there to signpost you on where you can go, and they'll try and answer some questions. So we'll step out of this main cafe room, and then we'll get back together again in this room at 12:50. Thank you very much, colleagues. Hello, and welcome back. I can see colleagues are still coming back. A lot of discussion was being generated within the groups that we're in. So apologies for coming back late into the sessions. I'm just going to check to see if we've got everyone else in the different groups come back yet. Catherine, can you confirm if everyone is back so that we can start our feedback?
If you just give it 2 seconds, Linda, I think there's just a couple of people trying to join. And yes, okay. Natalie, this is the correct room. Congratulations, you passed the correct factor test. Okay, I think that's for us now, Linda. So if you're not a speaker, please can you take your camera off? Thank you.
Thank you very much, colleagues, and welcome back. Thank you very much for being able to move into the different breakout rooms. I know in other sessions, we do struggle with this and end up losing quite a lot of people, but I could see a lot of colleagues had joined into the different groups. I'm now going to ask the breakout room facilitators if they can just summarize sort of the highlights just in a minute each, please. And then from there, I'll give an overall summary and then we will close the session. What I will reiterate is that we are going to be able to continue to answer some questions if you've got those in the chat. And certainly if anyone wants me to follow them up after this, if you let me know, I can do that immediately after the session. So if we can start with Professor Shem and Tracy Orlandi, please. So they were in breakout room 1.
Hi, most of our feedback was of a clinical nature, so I don't know if Professor Weishon is still with us and whether you'd be happy to summarise in a much more articulate way than I.
I'm not sure what I'm trying to summarize, really. We had the discussion on a range of different things about vaccination effectiveness and impacts on transmission, symptoms, and hospitalization. I don't think we should go through the data again.
Thank you very much to you both. Again, if colleagues do have any other questions, please can you put those into the chat and we'll try and respond to the questions. If we don't do that immediately, we may need to go away, find out the answer and then get back to you. So the next group had Dr. Prith and Elizabeth Calderbank.
Right. Shall I say a few things, Liz, or do you want to go first?
So in our room we talk about different topics. There were questions about, for example, how to manage relationships, with the family, about answering questions, a family that actually not necessarily work within the healthcare industry. How we convince our family and friends that it's important to take the vaccine, and how do we manage those relationships without compromising it. There were other questions about the need of having the vaccine when actually you can boost your immune system with vitamins and so on. There were other specific questions about, for example, having long-term conditions like MS. How do what is the risk involved not having the vaccine or having the vaccine with this particular condition? And also we talk about antibodies as well. So the efficacy, or how do we know we have antibodies? If we have the infection or the vaccine, and what is the role the antibodies play within the virus? I would hand over to Professor to summarize about the conversation we have in terms of those questions.
I think one other thing that the point you made, Liz, was that many people are not totally anti-vaccination. It's just a question of time and getting them on the journey. And people do, accept things after a while. So it's not a black or white, all or none. Yeah. Thank you.
Thank you very much. I'll now ask Dr. Vaishali Kogji and Chitra to then summarize for their group.
Thank you, Linda. So just wanting to briefly summarize, the idea of this session is to help you make a well-informed decision, and it will depend on each individual circumstances, obviously, so I would encourage you to find out as much information as you can and take the decision which you feel is best for you and go from there. And remember, there are people around to help you make those decisions. Please remember, the vaccine is not 100% protection, but it gives you a better chance. Okay, thank you. I'll let Chitra give a final note on that. Thank you.
Yeah, I echo with what Vaishali has said, and also it was really interesting as to what we discussed in the breakout rooms. Thank you so much.
Okay, thank you very much to colleagues. And then the last group, Dr. Anna Priya and Shelley Fields.
Hi, we had an interesting conversation about how to convince family and friends in our back home countries regarding theories around conspiracy about vaccines or medications coming from other countries, and that there are no other secondary gains of why these vaccines are being sent from other countries and why these can't be produced locally, and also about people who are who have been vaccinated but have still been getting COVID, but that symptoms have been possibly milder in them, and them not needing hospitalization or not having complications. So that was the main issues that we discussed.
Thank you very much, colleagues. I'm really mindful of the time, and thank you for your discussions and participations. I'd like to thank all our speakers and our facilitators within the breakout rooms. We have colleagues who are working in the background and have assisted us to go through this event without some of the Microsoft glitches that we usually have. I'm sorry that we were not able to then have our comfort break. We were very ambitious in the timing of our agenda, and from the engagement that we're seeing, it looks like this is one of the sessions that we should have had more time for, so that people could have additional time to discuss. So this is the start of a process. This is not the end. And as other colleagues have said, by all means, let's continue to have the conversations and share information. There'll be various other sessions that will take place. So again, you can pop into those to have discussions. Some of my colleagues have put their email addresses into the chat so that questions can then be asked and these will be answered for you. What I would like to just do is to just give colleagues a reminder of what we were able to cover in this session. So some of the things we were able to cover in this session is around why it was important for me to have the vaccine. So a colleague spoke to us about being a carer, about what it meant to them, what it meant for their family, as well as the patients that they look after. We also had information that was shared with us around why it is we're being encouraged to have the vaccinations and the differences between those who have been vaccinated versus those who have not been vaccinated, insofar as what those consequences might be and how severe it may be for someone if they're not vaccinated. There were some good discussions as well around how we need to frame this going forward, and an emphasis around those one-to-one conversations so that there's clearer understanding and people are comfortable to share any concerns, any anxieties, or just to ask the question that they might not be comfortable to ask, say, in a team meeting. Those conversations, having those one-to-one conversations, must be based on honesty and trust. Otherwise, if you do not have that, then you cannot progress the conversation. We also have some information around how the vaccination status has assisted some of our very vulnerable patients, specifically around some of those in our mental health settings where they may not be able to wear a mask, they may not be able to physically distance. However, we can see that it has not led to them having hospital admissions and being ventilated. And for some of them, yes, there may be those more severe consequences, but certainly from information shared, it has helped a lot of our patients in those areas. We also had information just reminding us about some of the childhood vaccinations that we had, and that vaccinations are not something new to the world. It's something that we've lived with and will continue to live with in the years to come. Some information around the progress that has been made with vaccinations, looking at things like smallpox, the work done around polio, and how these vaccinations have been effective. We then had some personal experiences shared around someone with an autoimmune condition and why they chose to have the vaccination and how this has assisted them and brought them into that feeling of there is a ray of hope. During various discussions, there has been questions around the efficacy of the vaccinations. There's also information raised around, if my choice is not to vaccinate, then why does it feel as though my choice is not being respected and this is being imposed on me? We've had discussions about it, certainly within our workshop, that people's choices will be respected. That's why they have that choice. However, organizations will make decisions, and that decision that the organization make might not be in line with someone's choice. And it's about us working together so that we have enough information as possible to be able to make informed decisions. A good discussion was also raised around medical exemption, that there will be colleagues who will be eligible for a medical exemption. And if this is not something that you have explored, please speak to your general practitioner so that this is something that you can be assessed for, because you may be that person who requires the medical exemption. I'd just like to close off, colleagues, by just reminding everyone around the workshop today. So just to say thank you to everyone who's participated and everyone who's joined in and certainly made this workshop as engaging as it has been this afternoon. We are here to share information. We are here to support decision making, but we're not here to coerce, to impose, or force people into making a decision. We respect that there will be different circumstances for every individual, and what we want to do as part of an NHS family, as part of an NHS community, is that, like anything else, when I set out on a day-to-day and suddenly I found something really nice, I found a nice pair of shoes, I want to share it with my friend. I'd like my friend to have that. So I just want to remind colleagues that as we speak and share our experiences, it's because we don't want to lose anyone in this family. I would like, if I've had something that's been a positive experience to me, I've been through it, I would share it with my loved ones. And that's why we're here hosting and facilitating this, so that we can share those experiences with you. We can try to respond to the areas that we can respond to, but certainly those that we do not have the answers to, we will go away and find out. Like every other vaccine medication that has been developed globally, we will continue to develop and improve it. So this isn't the final cut of the vaccinations. Work is still ongoing to improve the safety, to reduce those side effects, like we have done with other medications throughout the years. Colleagues, I hope you will all have a lovely day, a wonderful afternoon, and thank you very much for joining this session. There will be a few of us who will remain in this space for the next sort of 5-10 minutes, just to pick up if anyone is wanting to say something to us quickly before we drop off. Thank you.